Dr. Kumar mentioned being part of the elephant. I always realize I'm holding on to the tail when I'm near the elephant. I'm going to talk about, tell the story of. I'm going to talk about, tell the story of MAT and corrections in Rhode Island, and hopefully that'll translate into a larger discussion. After completing my training in infectious disease and HIV, I moved to Rhode Island in 1994 in the throes of the AIDS epidemic. Rhode Island was unusual in that more than half of the AIDS cases were related to injection drug use, and that was related to a law outlawing syringes. During the 90s, a third of the HIV cases in the state were diagnosed in the Department of Corrections. So I started going out there on a weekly basis, and I tell my students I've been behind bars every week for the last 24 years. But I've been released from behind bars every week for the last 24 years. Went about setting up model programs, and I should mention that Rhode Island is both a combined prison and a jail, which is few states have that. But a model program to diagnose the disease, start treatment, and link to treatment in the community, and test partners. But you know, HIV is less than 1% of the population out there. But as I'm out there, I started looking and seeing, well, there's a lot more diseases. I mean, half the people or more have a mental illness, half have an addiction issue. So why not do the same thing for other diseases? So started working over a decade ago, almost 2 decades ago, on, well, hey, we have methadone, why not treat opioid use disorder in the same way, diagnose it, start treatment, link to treatment in the community. Then I ran into a lot of resistance. And I figured the problem is not enough evidence. So I set about establishing the evidence base, applying for grants and writing papers and moving forward. And I had this epiphany in about 2015, and I just realized, you know, in spite of all this work that I had done, I hadn't really budged the dial. You know, in Rhode Island, if you were on methadone, you would be continued on methadone for a few days when I first got there. It was a 5-day detox, 50, 40, 30, 20, 10, and done, which is inhumane. But that is much better than neighboring Massachusetts, where you get 0. And over the years that evolved. We were able to start people on the dose that they came in on, and then we were able to push that out a week, and then we were able to push it out even further. But anyhow, in 2015, under the advice of colleague and friend Josh Sharfstein, the governor set up a task force to address the opioid epidemic, overdose epidemic, and I was fortunate enough to be one of the expert advisors, along with Tracy Green and others. We were given 90 days to develop a plan. We developed a 4-point plan. The key point was treatment, and we basically said, you know, Rhode Island has about 1 million population. We have about 20,000 people that we think would benefit from getting onto MAT, and we should see where those people touch the systems, identify them, and get them onto treatment, and at the same time expand treatment capacity. And of course, they touch in the entire medical system, in hospitals and clinics and emergency rooms, but also in the criminal justice system, in police and courts, prison and jail, and after jail in community corrections, probation and parole. So the governor said, well, that's great. That's a great plan. Where should I put my resources? And we said, you should put them into corrections, because that's where the people with most advanced disease, you know, people become desperate. They resort to stealing. They resort to getting involved in the drug trade and the sex trade. And all of those activities get them caught up in the criminal justice system. There's also this situation where they're taken off of opiates or reduced their use dramatically, and their tolerance goes down. And so they're released at a time when their tolerance is low and at a time of maximal stress and triggers, and they relapse and they're set up to overdose and die. So the governor allocated $2 million. I spoke to the director of the Department of Corrections around that time, and he said, Jody, you know, you've worked long and hard in our system, and you've really, you know, my staff is starting to come around about this methadone stuff. You've done some really good work, but they're not ready for this Suboxone, buprenorphine, you know, they're not ready for that. And I said, well, Director, with all due respect, it doesn't matter, because the governor's going to tell you to do this, and you're going to tell your staff to do that, and if your staff wants to keep their job and you want to keep your job, you're going to do it. And he was sort of taken aback, but really that was critical, because it set the tone, hierarchical tone to make it happen. So we began in mid-2016. A year later, and Jennifer Clark is the medical director. She said, we're going to screen everybody. We're going to start the most effective treatment that we have, and we're going to make sure they connect to treatment on the outside. She did that, and within a year we showed a 60% drop in overdose deaths and people being released from incarceration. And I was just going to end with a few things that jumped out at me that I was a bit surprised. First, most people say, yes, I want that treatment when offered. Second, most people have a preference. They know what they want. They want either methadone or buprenorphine. Very few chose naltrexone. And I would say the most critical thing is connecting people to treatment in the community. If you don't have treatment to connect people to, you're not doing any favors by starting a treatment program in corrections. So I think we've shown that this is doable. But our major investment in this problem of opioid use disorder, it remains in the criminal justice system, and we really need to change that and invest in treatment and get people out of the criminal justice system. And I would finally just say that we should really examine closely the Portugal model, where they have diverted people from the criminal justice system into treatment. Thank you.